Now I'd like to invite Dr. Nalini Campillo. She's a diabetologist and a coordinator of the Diabetic Foot Clinic in Plaza de la Salud Hospital in Santo Domingo in the Dominican.
Dominican, yes. Dominica is another island.
That's what I can pronounce. Anyway, so please go ahead and tell us about South America.
Thank you. Thank you for the organizing committee, and a special thanks to Dr. Javier Aragon for this invitation. Well, yes, diabetes is a huge and growing problem. No countries are escaping of the diabetes epidemic. All nations, poor and rich. But in states and territories worldwide, it is the poor and disadvantaged who are suffering most. 80% of the people with diabetes live in low and middle income countries. My country, Dominican Republic, belongs to the SACA region. SACA means South and Central America. And in this region, 24.1 million of people is suffering for diabetes. By 2035, the number of people with diabetes will increase 68%. This is the SACA region, and I'm going to show you the top 7 countries, territories of number of people with diabetes. Brazil has the highest number of people with diabetes, with 11.9 million. Followed by Argentina with 1.6 million, Colombia with 2.1 million, and Chile with 1.3 million. The highest prevalence of diabetes with 13.0 is Puerto Rico. Then followed by Nicaragua with 12.4, and my country with 11.3. Diabetes caused 5.1 million deaths in 2013. Every 6 seconds, a person dies from diabetes. And in South and Central America region, we have 44.2 deaths due to diabetes. Here, you're going to see the 5 most affected countries by poverty in Latin America. The first one is Paraguay. The second one is my country, Dominican Republic. The third is Colombia, Ecuador, Venezuela. And here is where I live. Dominican Republic is a beautiful island between Cuba and Puerto Rico. You're gonna find the music, merengue music of Juan Luis Guerra. It's a style of music. You're gonna find a beautiful beach, but this is not so beautiful. At the end of my conference, I'm gonna show you which one is my favorite one. You're gonna find a very good seafood, very good rum, very good beer. But for these people, the diabetic population, that is almost 1 million of Dominicans, we are the 7th place of prevalence of diabetes in Latin America. And the 42.2% of poor people, that means the 2nd place of poverty in Latin America, there are no holidays. Why? I'm going to show you what is the cost of diabetes in Dominican Republic. The minimum salary is almost $200. That means 8,000 pesos. But the family card is about $600. The insulin costs $3 if you're using that kind of insulin. But if you're using analog, it's another price. Can you imagine for a while that that patient comes to your office with a diabetic foot? Are you going to prescribe a gammography to check for osteomyelitis? Maybe you can use an X-ray, and for sure, you're going to use a probe to bone test. What's going on? It's very simple. We have a control card, an uncontrolled card. What is the control card? The control card is a dietary regimen, low fat, no added sugar, routine exercise, daily monitoring, insulin use, consultations, laboratories. The diabetic patient should consume large quantities of this card to avoid complications. But the full price of this card is high in monetary terms, personal effort, discipline, and time. What happened with the uncontrolled card? The uncontrolled card, diet does not consider levels of fat, portion sizes, and/or combinations of foods, low levels of physical activity, sporadic monitoring of sugar, and of course, no prescription drugs. Due to its characteristic or partial consumption, the full price of this card is significantly lower than the control card. Which one do you think the Dominican patient will use? Not only increases the risk of morbidity or mortality in diabetic patients, it's also represented cost to the state. Let's assume that the prevalence of ulcers, 50%. The patient will develop an ulcer in one point of their lives. I coordinate a diabetic foot clinic in my country, and I see almost 4 or 50 patients in one day. 4 or 5 of these patients are under 25 years old. I don't have a data about this, but maybe for the next EWMA, I'm going to work with Dr. Aragon with a paper about this. The political measures taken to combat diabetes in Dominican Republic, well, we have a law, the 8701, that allows entry into force of the family health insurance in May 9, 21. The decree is the tax exception for insulin, the payment of import duties and insulin, the access to drugs through those pharmacies that you saw there. They call the pharmacy for poor people, and the subsidy through private institutions. That private institution that is called Learning to Live, it's an institution for young boys and girls, and they are giving support with the insulin. That's all we have. The first time I saw the step-by-step program, there was a doctor that was talking about that, and he asked me, would you like to have this program in your country? And I said, yes, please. That doctor is Stefan Morbach. And 8 years after that, we start the step-by-step the last year in Brazil. The first pilot project was held in Brasilia, in Brazil, from 6 to 8 December 2012. And as you can see, this is the local and international faculty. And we had 100% attendance in those courses, 59 people, of which 15 observers from 14 countries of the SACA region participated. The course was in Spanish, in Portuguese, and in English. And now all those countries finish the basic course, and we're going to start the advanced course. That was the first time in Latin America that the step-by-step was implemented. Right now, in my country, we have 15 hospitals have been trained. We're going to continue with the advanced course. I think that if every problem contains within itself the seeds of the solutions, I think we have 365 days to think what we can do. And this is my favorite wish. Thank you for your attention.